Health editor Dr. Howard Tormin has the story from the newsroom. Doctor.
Yeah, I got an interesting question for you. When you go to bed, how do you know if or when you've fallen asleep? Now, that's not nearly as screwy as it sounds, because a lot of folks think they have insomnia when in fact they just don't realize that they have gone to sleep. It's a very strange problem that the sleep lab at Loma Linda can now fix. Imagine trying to get some sleep all wired up in a laboratory with doctors looking on. But this is how a lot of folks are now getting their sleep problems resolved. Folks like Lynn Chopek, who complained of insomnia for years.
I thought it took me about an hour or 2 hours to fall asleep. I mean, I would have sworn on it. I mean, you can ask my friends, just a lot of people who I would always complain to that I did not sleep.
But the problem turned out not that she could not get to sleep, but that she thought she was still awake. It's a problem that a new study at Loma Linda University shows can be treated by teaching people to recognize when they're asleep.
We began to understand that there are a lot of people with excessive mental activity who could not discriminate when they were awake or asleep. So we trained them by basically interrupting sleep, ironically. Basically awakening insomniacs, if you can imagine. They at first weren't too happy about this.
In the study, by keeping track of the patient's brain waves, researchers knew when someone was really awake or really asleep. And when they saw someone start to drift off to sleep, for instance, they would ask the patient, "Do you think you're asleep or awake?" They did this repeatedly and later showed the patients how their answers compared to their brain waves on an EEG.
So that they began to notice certain physical cues to relate to the EEG that we were seeing. So it became sort of a matching game, a game to match the EEG with their perception. And by doing that, improving their perception of sleep.
It solved Lynn's insomnia problem.
Consistently after the research, they showed me that it took me 12 minutes to fall asleep.
Now, a lot of people get relief from insomnia just by watching how much caffeine they consume, going to bed at night the same time every evening, not oversleeping, learning to relax, and so forth. But if those things don't seem to help, it may be because you just can't tell if you're really asleep. And a program like Loma Linda's might help you.
Or relief in terms of sleeping pills, that's not a good idea.
Actually, it can be okay on a temporary basis. If you've had a bad day on the job, you've had a death in the family, something has upset your life, then using sleeping pills temporarily, not a bad idea, actually. Will get you over the hump, you get the rest you want. The problem is when you start using sleeping pills on a regular basis, they become a regular problem and you will never resolve your sleep problems. They'll actually get worse for you.
Okay, a hot bath, Howard.
Yeah.